Today, we are going to share with you an important scientific study published in the journal Science. Results of this study show that the COVID-19 saliva test easier and give more accurate information about the disease.
As we all know that polymerase chain reaction or PCR is mainly used to detect the COVID-19 virus. Samples are mainly taken from the nasopharyngeal region through a swab. Scientists have the capability to determine how much virus is present in a particular sample. A new PCR test has been developed that can detect COVID-19 causing virus in the human saliva. Important to mention here is that the saliva test also give information about patient survival and overall disease information.
You might like to know why we are talking about the superiority of saliva PCR over nasal samples PCR. This is based on a scientific study conducted at the world's top-ranked Yale University, USA. Scientists of this university evaluated 154 COVID-19 patients in this study. Saliva was collected from patients and the amount of virus determined by quantitative PCR. Divided patients into three groups. Patients having low amount of virus in saliva, medium amount of virus in saliva, and the higher amount of virus in saliva.
Patients who developed the severe disease, were hospitalized, or died were more likely to have had high virus loads in their saliva tests, but not in their nasopharyngeal swabs. Viral load in both saliva and nasal mucus declined over time in patients who recovered, but not in those who died.
You want to know more about this scientific study entitled "Saliva Could Hold Clues to How Sick You Will Get from COVID-19"? Please follow the link provided in the comment section. The study was published on January 13, 2021.
In the meanwhile, the Biomed Global and United Virologists advise you to please keep observing precautionary measures to stay safe from the COVID-19 virus.